Welcome to MedRU. Topographic anatomy of the head. In this video, we will consider the topography of the frontal-parietal-occipital region, as well as the features of hematomas. Region boundaries. From the front, this is the nasofrontal suture, supraorbital margin. From the side, this is the superior temporal line. From the back, this is the superior nuchal line, the external occipital protrusion. Layers of the frontal-parietal-occipital region is skin, subcutaneous adipose tissue, superficial fascia, muscular-aponeurotic layer, subaponeurotic adipose tissue, periosteum, subperiosteal adipose tissue, skull bones. After the bones come the membranes of the brain, the intermeningeal spaces, and the brain. The skin of the frontal-parietal-occipital region is dense, thick, and slightly mobile, especially in the occipital region, where the subcutaneous tissue forms dense bridges between the skin and the aponeurotic layer. Over a large area, the skin is covered with hair and contains a large number of sebaceous glands. Through the subcutaneous fat tissue from the skin to the muscular-aponeurotic layer pass dense fibrous vertical bridges, which divide the tissue into isolated cells from each other, containing a large number of sweat glands. The superficial vessels and nerves pass through the subcutaneous fat. The supratrochlear and supraorbital arteries, branches of the ophthalmic artery from the internal carotid system, are distributed in the area of the frontal bone. They are accompanied by veins and nerves of the same name, from the first branch of the trigeminal nerve, nervus ophthalmicus. The terminal branches of the superficial temporal artery, from the external carotid system, are distributed in the area of the parietal bone. Veins of the same name and the auriculotemporal nerve, from the third branch of the trigeminal nerve, nervus mandibularis. The posterior auricular and occipital arteries, from the external carotid system. Veins of the same name, the posterior auricular nerve, from the facial, the greater occipital nerve, the posterior branch of the second cervical nerve, are distributed in the area of the occipital bone. The superficial fascia is not expressed. It tightly fuses with the tendon helmet and is not differentiated as a separate layer. The muscular-aponeurotic layer consists of the frontal muscle, the occipital muscle, and the tendinous aponeurosis equals helmet. The tendinous helmet is firmly connected to the skin and loosely to the periosteum, as a result of which scalp wounds are often observed on the cranial vault. The integumentary tissues are peeled off from the periosteum in a single flap. The subaponeurotic tissue is located under the frontal and occipital muscles and the aponeurotic helmet, separating them from the periosteum. It is a loose tissue, unlike the subcutaneous fat tissue. The periosteum is a thin fibrous plate that consists of two layers, an outer fibrous layer and an inner osteogenic layer. The fibrous layer consists of dense fibrous connective tissue that attaches the periosteum to the bone. the osteogenic layer consists of loose fibrous connective tissue that contains osteoblasts involved in osteogenesis. The periosteum is penetrated by nerves and blood vessels that provide it with nutrition and innervation. Nerves provide bone sensitivity, and blood vessels deliver nutrients and oxygen to the bone. Bone injuries can damage the periosteum, which can lead to decreased trophism and slowing or cessation of bone growth, as well as its resorption. The subperiosteal tissue is loose, but along the line of sutures it is firmly fused with the bones. The frontal, parietal, and occipital hands consist of an outer and inner plate, between which there is a spongy substance diploe. The inner vitreous plate is fragile, and is more often damaged than the outer one. Damage to the inner plate is possible with an intact outer one. Diploic veins are located in the spongy layer of the bones of the vault. They are connected with the superficial veins, extracranial system, and with the sinuses of the dura mater, intracranial system. The superficial and diploic veins are connected with the sinuses through emissary veins of the emissaries. Due to the presence of connections between the extracranial and intracranial venous systems, infection can be transmitted from the superficial layers to the meninges, in furuncles, carbuncles, with the subsequent development of meningitis, sinus thrombosis, and other severe complications. The caliber of the diploic veins is inversely proportional to the size of the emissaries. The variety of forms of hematomas that occur with skull contusions is explained by the peculiarities of the anatomical structure of the skull. Subcutaneous hematomas protrude in the form of a hill due to the impossibility of blood spreading in the subcutaneous tissue due to the presence of fibrous bridges between the skin and the tendon helmet. Subaponeurotic hematomas are flat, diffuse, without sharp boundaries. Subperiosteal hematomas have clear edges corresponding to the attachment of the periosteum along the line of bone sutures. This concludes our study of the frontal-parietal-occipital region. Don't miss useful materials. Subscribe to the channel to watch materials on topography, quickly access video materials, and conveniently view materials and communicate with colleagues. Good luck in studying topography.